Thanks for tuning in. This is John Russell, and this is episode 4 of season 1 of Total Thyroid. And I'm providing an edited introduction to this topic about Graves' disease because since I recorded this video just a couple of days ago, I actually found out that somebody very close to me has had Graves' disease that they've been trying to just treat naturally for the last few years, and they've gone on to develop a very serious heart problem. So everything that you hear on this podcast is things that I actually believe medically that I have data to support. But in addition to that, this is personal. As you listen to this, take that in mind and enjoy. This is episode 1.4, and we're going to talk today about Graves' disease, what it is, and what is the most natural treatment for Graves' disease. For those of you who don't know me, I am a board-certified surgeon who started the Russell Center for Endocrine Health after spending about a decade at Johns Hopkins, and before that, 5 years at the Cleveland Clinic. I only do thyroid and parathyroid surgery. That's my entire practice. I was the director of the Thyroid Tumor Center at Johns Hopkins for that time that I was at Johns Hopkins. I do scarless thyroid surgery, radiofrequency ablation, etc. What prompted this conversation about Graves' disease? What is Graves' disease? Let's go into that. Somebody showed me a picture of a patient who was describing her journey with Graves' disease. This is not my patient, but online this patient had documented that she had a fistful, literally about 10 pills in her hand of quote unquote natural things that she was taking for her thyroid condition, her Graves' disease. And she has been documenting this over more than 3 years that she's been taking these natural remedies. The last 3 years, she has had significant anxiety, significant weight loss. She's had heart palpitations. She's going through a divorce. She's going through a lot. And as she's going through all of these different things, she shows this handful of pills and say, hey, look, this is great. This is going to help me out. And she's been doing this now for 3 years. And I felt like I should comment that actually I think there's a more natural way to treat Graves' disease, and I thought that that was surgery. And that turned into a big firestorm about how surgery could be more natural. And so for today, the purpose of this conversation is going to be talking about Graves' disease and it being more natural. I am going to be very transparent right now. I am a surgeon. I get paid for doing surgery. And guess what? I think surgery is the best treatment. So do I have a conflict of interest? 100% I have a conflict of interest. And in the same way that the chiropractor that she's going to right now gets paid for giving her a handful of pills, we want to give you our best opinion, our biased opinions of what we think is best. And then from there, help you decide what's going to be the best treatment for you to have. So again, I'm a surgeon. The reason that I'm a surgeon is because as I was going in medical school trying to pick what I wanted to do, I felt that surgery offered the most patients the best chance at having a long-term durable cure from significant problems like Graves' disease. And boy, think about people with autoimmune conditions. If they could have one surgery and then put a problem behind them, wouldn't that be amazing? And guess what? That's Graves' disease surgery. That's what it is. And I'm going to go into that a little bit later. So yes, I do have a bias as we talk about Graves' disease and about what I think is the correct treatment. But remember that I wasn't born a surgeon. I chose surgery because it seemed like it helped patients more than anything else. So I'm biased. And I chose this pathway because I had all of the other options open to me. I could have been a chiropractor or anybody else, but we digress. Let's back up a little bit and let's talk about Graves' disease. Let's keep going. So Graves' disease. Graves' disease is an autoimmune condition where your body decides to attack your thyroid. Now, it is, for all intents and purposes, just the other end of the spectrum of Hashimoto's thyroiditis. Hashimoto's thyroiditis is incredibly common. And in that condition, when your immune system starts to attack your thyroid, it slowly kills it so that eventually it stops working for most people. And Graves' disease is a little bit different because instead of killing your thyroid, it actually stimulates it. It makes it grow bigger and it makes it release extra thyroid hormone and it takes up extra blood from your body and it can start to cause swelling in your neck. And also those same antibodies can attack your eyes and give you the big bulgy eyes that sometimes you see with people who have Graves' disease. It is an autoimmune condition. And so when people talk about treating Graves' disease, it is very common that people say, what is the most natural way to treat Graves' disease? How can I do that? It's an autoimmune disorder. Should not we be treating the immune system if it's an autoimmune disorder? The answer is kind of. Yes, it is an autoimmune condition. And yes, if we can get your immune system to leave your thyroid alone, that's the best case scenario. And that's why there has erupted this entire population of influencers online who say, if you avoid gluten, or if you do this, or if you do that, if you have more selenium, whatever it may be, if you take more turmeric, because we understand it is your immune system, and all of those things can modulate your immune system. So theoretically, it would work great. The problem is our ancestors have tried all of those things forever, right? And they weren't able to cure Graves' disease. And if you look back through the reports over the course of time, these are pretty common conditions that are life-threatening in a lot of cases and life-shortening in almost all cases. So the natural course of Graves' disease, if you don't do anything, it will shorten your life by increasing your metabolism so much that you have to eat everything, but you still don't gain weight. You feel super tired, your heart races, you lose your hair, you just don't feel well at all. You just kind of feel miserable. And that's what happens with Graves' disease if you don't treat it. The biggest thing that we see nowadays in 2025 is that if you have Graves' disease, then you are going to have strain put on your heart so that 20 years, 30 years from now, your heart has abnormal rhythms. And those abnormal rhythms will cause strokes and heart attacks at a much higher rate than the general population. And so for patients who don't completely treat their thyroid, those are patients who end up with permanent problems needing to be on blood thinners for the rest of their life. Now, again, I chose surgery because I think medications like blood thinners for the rest of your life are kind of crummy. My grandpa died from a fall where he had a brain bleed, and in part that was exacerbated by a blood thinner that he was on. Anything that you do, any choice that you make, no matter how natural it is, there are risks that go with it. And if you incompletely treat Graves' disease, you will be much more likely to have long-term heart problems. That is very clearly established. And so patients say, well, what is the best thing that I can do to make myself live longer? And if that's what you're asking, then the answer is surgery. You will live the longest if you have surgery relative to any other treatment, no matter how natural. So now that you've got that out of the way, now that you know what Graves' disease is, it's an autoimmune disorder where your body stimulates your thyroid and makes it bigger and makes it release more hormone. Now we can start to talk about the different treatment models. Now, before we do that, we know that as soon as you have Graves' disease, your quality of life is impacted in a big way. You just don't feel well. We talked about that a second ago. You're going to feel poorly if you have Graves' disease. Any of these treatments that we're going to talk about don't make you feel perfect. And I think that that's one of the big problems that we have as doctors is we think, oh, you're treated, therefore you're fine. And if your labs look good, you're fine. The fact of the matter is the research is actually pretty clear. If you have Graves' disease, it will impact you for the rest of your life. Think about that with any other autoimmune disorder. It makes sense. If you have rheumatoid arthritis, it's going to bother you for the rest of your life, no matter how good your treatment is. And we hope to find a treatment that doesn't cause side effects and requires as little intervention in your daily life as possible and prevents long-term complications. That's what we're looking for with rheumatoid arthritis. And we look for the same things when we're trying to treat your Graves' disease. So that's our holy grail of what we're looking for. But if you have an autoimmune condition, you're going to have an autoimmune condition. And yes, some people will spontaneously relapse or go into remission. That's amazing and that's fantastic. But it doesn't commonly happen to most people. And so doing something and expecting that to be your outcome is not supported by science. There is no diet that has been researched that says that you can fix your Graves' disease. That's just very exceptional when it happens. It can happen, and it does because lots of people get Graves' disease. But if you expect it, if you expect that that's what you're going to get from changing your diet and doing all of these things or taking turmeric, you're going to be disappointed because that is the exception rather than the rule. And it's the same with all of these autoimmune conditions. Sometimes rheumatoid arthritis goes into remission for a little while and you might have good periods of time. Graves' disease is just another autoimmune condition. So the same thing happens with Graves' disease. You might have good periods, but in general, until you completely treat your Graves' disease, you're going to have good and bad periods that kind of come and go. Okay, what are the 3 treatment options for Graves' disease? Number 1, you can do anti-thyroid drugs such as methimazole or propylthiouracil. Those are the two drugs that we commonly talk about. You could also do steroids because we know that steroids work for acute flares of immune attack or autoimmunity. So any of those three things. Long term, I'm just going to talk about steroids and get them out of here first and foremost. Long term, we don't want anybody to be on steroids forever because it attacks your immune system too well. It tunes it down so that it can't do what we need it to do to take care of you. So we need your immune system. We can't turn it all the way off, and steroids turn it all the way off, and they cause their own problems. So that's why we don't put people on steroids for the rest of their life. There's that one. So now let's talk about the other two. Before we do that, I want to mention the next two options are surgery and radioactive iodine. So those are the other two. So anti-thyroid drugs, surgery, radioactive iodine. We're going to talk about each of those in order. Methimazole and propylthiouracil. What's the difference between the two of them? What do they do? How do they work? And are they natural? Of course they're not natural, first of all. Natural would be letting your thyroid kill you when you have Graves' disease. That's what naturally happens. And we don't want natural. We want to get in and intervene and stop your immune system from wreaking havoc on your body and stop your body from getting too much thyroid hormone. That's what our goal is. And so as you think about these different drugs, methimazole stops that process of making that thyroid hormone in the way that your body needs it to, all the precursors that go into it. It keeps your body from having the active form of thyroid hormone that causes long-term problems. And propylthiouracil essentially does the same thing. So that's what those two drugs do. They're very effective at it. And usually you would start those drugs and stay on them for about 6 months. What are the pros and cons of those different options? Well, the pro is that it's pretty easy to take these drugs. You take them maybe up to a few times a day. And as you take them over a period of time, it gives your immune system a chance to kind of slow down and go into remission by itself. And it happens with some patients. Usually less than about half of patients will go into remission after about 6 months. Now, the negative of these drugs is that they can cause life-threatening liver complications, bone marrow complications, and they also cause birth defects. And so if you're a woman of childbearing age, you need to be extremely cautious if you're taking methimazole, and we would usually put you on propylthiouracil, but even PTU has an increased risk of birth defects. And that's out of a big study from South Korea. And so all of these drugs would be short-term things that we would take that do have potential life-threatening complications, but for some people, they will take them, and after a period of time, their condition will spontaneously remit and they will be okay. Now, if it doesn't go into remission at the 6-month window, you can just restart the methimazole all over again and try it again for another 6 to 12 months. There is a very recent report that you could add some chemotherapy to these drugs. And if you're worried about being natural, well then, yes, chemotherapy is not natural to take, but you can add chemotherapy. And there is a report that suggests that that might make it more effective at getting your immune system to leave your thyroid alone and kind of let you go back to being fine. And that would be the best case scenario, is if your Graves' disease just kind of turns itself off and stays away forever. And again, that's a little bit less than 50% of patients will have that go away. Long term, what we see as far as problems from it, if you don't have any birth defects or et cetera, if you do really well, the long-term biggest complication is that the more time you spend in the middle of a Graves' flare, the more likely you are to have those heart problems that we talked about earlier at the end of your life. And so even if you do okay and you maybe lose a little bit of weight, maybe have some palpitations in your heart, you have those things and you kind of just deal with it and kind of get through it. Long term, if you're going up and down, that will cause strain on your heart. And over the long term, you are more likely to have a long-term complication that we talked about before, specifically cardiac-related death. So that's those drugs: methimazole, propylthiouracil, and steroids. They all work by trying to give your thyroid enough time to get away from your immune system and make your immune system leave it alone. We do know that patients who even go into remission do not have the same quality of life as people who do not have an autoimmune condition, and that's just common sense. And so when you're talking to your friends and you don't feel well, even though you're in remission from Graves' disease, that's why. If you have a thyroid problem, you have a thyroid problem. Your life is affected. Your quality of life is affected. It's a big deal. It should not be minimized. And any of these treatments do not make that go away and make you go back to normal. Okay, the next one we're going to talk about is radioactive iodine. With radioactive iodine, you take a small pill of iodine that is radioactive. And when you take that pill, it is primarily taken up in your thyroid because your thyroid uses iodine more than most other parts of your body. And when it's taken up in your thyroid, then that radiation kills the thyroid cells and it makes them kind of shrink and die. And again, that buys some people a chance for their immune system to go into remission. Of the three different options, surgery, drugs, and radioactive iodine is the least likely to make your antibodies go down. In other words, with radioactive iodine, usually your immune system goes up. And that's why we see that the eye problems usually become worse for people who have radioactive iodine. And if you already have eye problems, you can't have radioactive iodine because we know it's going to make them significantly worse. So we don't do it. Also, if you're smoking, you should probably not do radioactive iodine because that can definitely exacerbate problems with your eyes as well. So radioactive iodine is not going to make your immune system calm down. It is pretty easy for about half of the patients. They take one pill one time, and that kills off their thyroid enough so that their Graves' disease is manageable. Some patients have to do it multiple times, and some patients never go into remission. If you look at it long term, there is a very small risk of patients having a second cancer or rather a cancer that is caused by the radioactive iodine. It's a very low risk. It's pretty minimal, but it's not zero. And so if you have a big thyroid already, if you have nodules in your thyroid that you're going to have to follow, because we know that Graves' disease is associated with thyroid cancer, if you have those things, then you might really want to think twice about whether or not it's the right thing for you to do radioactive iodine. And usually for most people, it's not ideal. So, okay, that's radioactive iodine. It used to be a lot more common in the United States. It's becoming less and less common as time goes by. Finally, surgery. And what is surgery? Well, with surgery for Graves' disease, we take out your entire thyroid. And that means that you are dependent for the rest of your life on thyroid hormone. And that means every single day, you're going to take one small pill to replace that thyroid hormone. That pill can either be naturally derived, where we would take it from a pig or a cow or something like that and just take their thyroid, or it can be artificial or synthetic, where we generate that. If you have cancer, we usually like to have more control and have a cleaner product. And the synthetics tend to be a little bit more molecularly clean. And so we would usually recommend, at least for the short term, that you start off with one of those. But all of these things are negotiable. Really, the goal is you find the dose of hormone after surgery that makes you feel well. But if you have surgery, you still have to find that dose. It takes a little while to figure that one out. There are risks that go into surgery, specifically your voice, sometimes your parathyroid glands, and then all the risks of anesthesia and bleeding and infection and all the other things that go into surgery. And those are risks that you have right up front when you're having any surgery, and you know about those risks. And it's really important that you find a surgeon who does lots of thyroid surgery and lots of Graves' disease surgery, because the more you do, the better you get. And if you have complications, especially complications related to your parathyroid glands, it's a big deal because that will really affect your quality of life. Okay, let's talk about quality of life with surgery. As you look at this diagram, there's a great diagram, I'll try and put it up in the study notes, that shows the different quality of life after any of these treatments. And the best quality of life is if you don't have a thyroid problem. But guess what? If you have Graves' disease, you have a thyroid problem, so your quality of life is going to go down. You have an autoimmune disorder that affects your quality of life. So as your quality of life goes down, what you see is that methimazole and surgery have very similar long-term quality of life. There's really only one study that was ever done that randomized patients and said, hey, this is your option. We're pulling it out of a hat. You're either going to have surgery or radioactive iodine or drugs. And in that study, what they found was that methimazole and surgery both have the same quality of life after treatment. Radioactive iodine had the worst quality of life. And so even including the risks that go into surgery, including all of that, surgery and methimazole were the same as far as long-term quality of life. Again, the advantage of surgery is that you immediately take away the thing that is stimulating your immune system, and that's gone. Now, your immune system will still be on a hair trigger because you did have an autoimmune condition, and that is still something that you're going to have to balance. But you've taken away the main thing that is inciting problems with your immune system. And so when you take that away, for most people, over a period of a few years, their antibodies tend to go away as well. And so that's one of the big advantages. And so that's why when I talk about what the best, most natural treatment is, the most natural treatment that gets your immune system to go back to ground zero is actually taking away your thyroid, because all of a sudden the rest of the cells of your body aren't having to absorb these pills that you're taking. They're not having to absorb all of the extra thyroid hormone that your body's making. And instead they just go back to an appropriate dose of thyroid hormone for your body that you can titrate to feel as well as you need, and to make sure that you have the long-term benefit that you need without having long-term heart problems. And again, of the three different options, surgery is the least likely to give you eye disease or cause long-term problems with regards to your heart. And so that's kind of the final point. And oh, by the way, you can do thyroid surgery for Graves' disease without a scar. That's an option. So let's kind of wrap this all up and let's do a little conclusion here. For Graves' disease, once you have an autoimmune condition, the natural course of an autoimmune condition is that it will try to kill you. That's what happens. If you try to change your diet and do all the rest of those things, good for you. That's fantastic, and it may help. But scientifically, it is highly unlikely to help. Instead, some patients will just get better spontaneously, and that's good news. But just like rheumatoid arthritis or lupus or any other autoimmune condition, most patients who get these conditions need some treatment. If you're looking for a natural treatment, the treatment that gets your body back to ground zero the fastest is getting rid of your thyroid. Because once your thyroid is gone, your immune system slowly calms down without that thyroid to agitate it. Methimazole and anti-thyroid drugs can also reach this state, but it more relies on your immune system just forgetting that it was attacking the thyroid. And for some people, that is appropriate and it works for about half of the patients. For other patients, they have to keep doing it over these cycles of on again, off again, until eventually they give up. If you do that, then you have to be following your labs pretty routinely to make sure that your liver is fine, make sure that your bones are fine, check all of those different things. And if you're following appropriately and you're doing all the right things the way that you need to, then following with a good endocrinologist is appropriate. With radioactive iodine, it's not really the most natural long-term course, nor is it the most likely to work. And it is not going to calm down your immune system. Instead, it will agitate your immune system more than the other two options will. So as you're trying to decide which one's going to make you the happiest long-term, that's a very personal decision. Surgery is scary. Losing an organ and relying on thyroid hormone for the rest of your life, that's scary. I get that. You should just know that the data is pretty clear that your quality of life is going to be slightly lower if you have Graves' disease, but it's going to be almost exactly the same if you have methimazole or surgery. And of those two options, surgery will make you live the longest. And so you need to talk to your endocrinologist. You need to talk to different people to get their opinion about what the best way is to treat your thyroid. But you should know, if there was an easy way to take turmeric and fix your Graves' disease, or an easy way to change your diet, somebody would be making lots of money on that right now within big pharma. There would be doctors that had set this up all over the place to take advantage of it. The fact of the matter is, scientifically, these things just don't work, or at least they're not reproducible. Some patients will get lucky, and that's fantastic, but some patients would get lucky whether they did anything or not. And so before you spend your life savings trying to talk to a chiropractor who's going to give you these different things, I don't even know what to call them, supplements maybe, just make sure that you've really done a deep dive into the research and what it actually shows, and understand what this condition is. Graves' disease is an autoimmune condition. It's not going to get better unless you treat it the right way. And that means methimazole, radioactive iodine, or surgery. Good luck. Thanks for listening today. Hopefully this was beneficial for you. And if it was, please share it with somebody who needs to hear about this information. Like it, give me a comment, let me know what you think. Bye now.